The third question is an OT. It's completing a pre-discharge evaluation after the client's 3 months of outpatient OT following a hand injury. The individual has not been able to work for 3 months and is unable to perform all the job requirements as a truck driver. Which should the OT recommended discharge? The correct answer is C. The work hardening program is the most suitable choice because it's specifically designed to assist individuals in returning to work by simulating job-related activities, enhancing physical stamina, and improving overall work performance. A home exercise program would not be appropriate because it's not targeting job-specific activities. And the home health OT, this is typically for individuals who are homebound and are not able to access outpatient services, which is not the case of the question. Okay. The second one, an OT, it's preparing to evaluate a toddler who has upper extremity orthopedic concerns and difficulty with self-feeding while at childcare. How would the OT most likely obtain initial assessment data? So the correct answer is letter C, observation in the child during eating activities in the childcare center. Observation is one of the most effective methods for the occupational therapist to assess the child's functional ability in their natural environment, specifically when it comes to self-feeding and other ideals. So I would not necessarily assess visual motor skills yet because it's not related to the self-feeding limitations that the upper extremity orthopedic upper extremity issues is causing. So, and the dynamometer and pinch meter readings are not developmentally appropriate for the student in the question. So the next one would be an OT working in a long-term care facility needs to evaluate the long-term memory of a resident, which is best for evaluating memory of personally experienced events, declarative memory. The correct answer is B, ask the individual how they spent the New Year's holiday. So by asking the individual, this is known as declarative memory, which is the ability to recall facts and personal experiences from one's life, including episodic memory. This is an excellent way for the OT to assess this type of memory, as it's used to ask individuals how they spend specific holidays, like the New Year's. This question is going to prompt recalling of personal experiences. So the other answers, letter A, this activity tests their ability to remember recently presented items, not personal past events. Letter C, asking individuals to state a place, date, and time. It's an orientation test measuring awareness of time, place, rather than long-term declarative memory. And D, asking the client to remember to bring a specific item to the next therapy session. It's going to evaluate the prospective memory, which is the ability to remember and complete future activities rather than recalling past personal experience, which is the primary focus of the question. So the next question, a person with a long-term history of Parkinson's disease is experiencing considerable fatigue during the day. The best way to enable the individual to maintain their level of function is to teach them how to. The correct answer is B, perform desired activities in a simplified manner to conserve energy. So Parkinson's disease is often causes fatigue, making it very important for occupational therapists to teach the individuals energy conservation techniques, simplifying the activities in order to to reduce the physical demands and allow the individuals to maintain a higher level of independence and occupational performance throughout the day. The other options, letter A, work through the fatigue. It's going to exacerbate the symptoms of the Parkinson's and it would not be an appropriate response. The letter C, employ pursue breathing. This is a technique which is relevant when the client has a respiratory condition like COPD and is not suitable for managing fatigue, that it's which is secondary to Parkinson's disease, and eliminating activities to reduce activity level. By doing this activity, we are going to limit the engagement in meaningful activities, and this would, of course, negatively impact the quality of life of the individual. So the next question is, an individual with Guillain-Barré acute syndrome demonstrates poor to fair strength throughout the upper extremities, which is the most appropriate approach for the OT to use when planning treatment for the early stages. The correct answer is A, gentle, non-resistive activities in the early stages of Guillain-Barré syndrome. It is very critical to avoid overexertion as it can worsen muscle weaknesses. Gentle, non-resistive activities are going to help maintain the mobility without taxing the muscles, allowing for gradual recovery. So the option B, which is progressive resistive exercises, this would be too aggressive for the individual in the early stages of Guillain-Barré syndrome and could lead to further muscle damage. And C, fine motor activities should not be the focus until the strength and the growth motor control have improved. The next question, following radiation therapy for breast cancer, an individual develops lymphedema in the right, which is the dominant upper extremity. She is experiencing functional deficits and is referred to occupational therapy. Treatment to reduce the swelling will begin with, the correct answer is C, fitting of compression garments. So the compression garments are very crucial for managing lymphedema, and they also help to prevent fluid buildup and promote drainage of lymphatic fluid. So answers C, the change of dominance training. This is a very beneficial, but it's going to be beneficial in the long term. So the immediate priority for the OT is to reduce the swelling. And letter B, which is isometric contractions, would not be suitable because the initial treatment of lymphedema is going to manage the swelling rather than strengthening the extremities. And letter D, a heat modality such as warm compresses. This use of heat modality is actually contraindicated as it can also further exacerbate the swelling. The next question is an OT. It's working with a woman with Alzheimer's disease who demonstrates mild to moderate decline. She lives with her husband who works during the day. The OT should initially focus intervention in which area? The correct answer is B, kitchen safety, because for individuals with mild to moderate Alzheimer's disease, safety during child activities I'm sorry safety during daily activities, especially when they're alone, it's very, very important. Prioritizing kitchen safety can help prevent accidents that can occur during cooking or using any appliances. So the other answers, chewing and swallowing disease, are not targeted during early stages as they will occur later on of the Alzheimer's. Anger management, there's no indication in the scenario in the question basically that there is that anger issues are a primary concern, and recognition of family members. And this issue becomes more relevant also in later stages of Alzheimer's disease. The next question, it's an OT. It's treating a restaurant worker with pain resulting from cumulative trauma disorder. The OT suggested using elastic taping to decrease pain in the upper extremity while working. In addition to decreasing pain, this type of taping can also, the correct answer is A, decrease inflammation and edema. Elastic taping, such as kinesio taping, can also help reduce inflammation and edema by promoting lymphatic drainage and improving circulation. And this process is going to also help with the pain and the swelling. The answers B, C, and D. So letter B, it's going to increase the muscle fatigue because the purpose of the elastic taping is to actually reduce the muscle fatigue by providing support to the muscles. Letter C, limiting range of motion. Unlike limiting movement, elastic taping typically allows for full range of motion while still offering support. And letter D, it's desensitize the upper extremity. Although this taping can be appropriate, can provide muscle support and alleviate pain, it is not primarily designed for sensory desensitization. The next question says an OT is working with an individual with amyotrophic lateral sclerosis who developed sacral decubitus and has recently become too weak to return himself in bed. What should the OT plan to do next in regard to client caregiver instruction? The correct answer is C. Teach the caregiver how to position the client safely. So the client has amyotrophic lateral sclerosis, and because of that, they're can be too weak to move themselves in the bed. So the immediate priority should be to instruct the caregiver on proper positioning techniques in order to relieve the pressure and assist in bed mobility. This is essential to prevent further skin breakdowns and manage sacral decubitus. Addressing these needs is critical to to prevent pressure sores. The other answers, letter A, begin with strengthening program. The strengthening program is inappropriate actually at this stage in amyotrophic lateral sclerosis, as the client is experiencing significant weakness. Letter B, wheelchair education program is this could be beneficial but in later stages of the ALS because they do not address the immediate need for proper bed positioning or managing the decubitus. And letter D, provide an environment control unit. Although this could facilitate independence in other activities, it does not meet the immediate requirements for the client, which is related to pressure relief and positioning. The next question is an OT is working with an individual. Oh, let's repeat it. An hospital-based OT is working on discharge plans for a 2-year-old child with paraplegic spina bifida who has just started using a power wheelchair. Which community resource recommendation is the most critical for this child? The correct answer is B, wheelchair equipment vendor. So this answer gives a community recommendation, which is critical to ensure that the child continues to meet developmental milestones, as well as to ensure proper feeding and any additional equipment that might be necessary for the wheelchair as the child grows. Letter answer A, social service agency. Although they might offer assistance, early intervention. Sorry. So a social service agency, although this and the early intervention are very important and they might offer assistance, they're not crucial aspects of the rehabilitation process at this developmental stage with the child. Um, and the family physician, it is very important for overall health. However, a family physician does not address the broader wheelchair and positioning that the child might need. The next question is, a client presents with chronic post-stroke upper extremity edema of the right arm and hand. Which would the OT most likely suggest to manage the edema? The correct answer is A, manual edema mobilization. Manual edema mobilization is a highly effective technique for reducing chronic swelling, especially after a stroke. This is a reliable method that promotes lymphatic drainage and helps decrease fluid accumulation in the affected limb. So the other answers are not applicable because a hot pack application actually can worsen edema by increasing the blood flow of the area, making this method less effective for managing the swelling. The paraffin treatments are primarily used to relieve joint stiffness or pain rather than reducing the edema. The next question is, an individual with left upper extremity flaccidity is observed sitting at a table in his wheelchair at lunchtime with his left arm dangling over the side. The first positioning strategy OT should introduce to the individual is letter A, position the upper extremity on the tabletop surface with a Tyson. So actually, positioning should be the first strategy the OT should introduce before recommending or seating a client with equipment in order to increase body alignment and increase occupational engagement. A lap tray does not offer enough support and prevents the arm from dangling, which can lead to potential injuries, as well as repositioning the arm back on the wheelchair armrest, because if we know that the individual already has a flaccidity, this is going to actually keep happening. And using an arm sling might not it will contribute to further contractures and restrict the active range of motion of the upper extremity. Okay, the next question is, an OT is working with an individual whose status post right upper extremity shoulder replacement decline is right-handed dominant and a woodworker. Currently, limited right upper extremity range of motion prevents participation in woodworking, which requires at least 120 degrees of shoulder flexion. The OT and the patient collaboratively develop a plan that incorporates woodworking to increase right upper extremity range of motion. After establishing the just right challenge at 40 degrees of shoulder flexion to stem the piece of wood project, how should the OT progress the patient to achieve the goal? So the correct answer is D, involve them in standing and staining increasingly larger pieces. So the keyword here is that they found the just right challenge, because they're gradually going to increase the size of the pieces to be sanded, which is going to further improve shoulder flexion by providing and encouraging control movement and promoting gradual improvement in the range of motion. This task is going to also align directly with the client's goal of resuming woodworking. So letter A, progress them to the use of power tools to sand the wood pieces would not be appropriate until further progress is made in the range of motion. And B, heavier wrist weights might not be addressed the shoulder flexion range of motion as needed. And the bilateral coordination, this might be useful later on in the treatment intervention, but it's not the primary focus on improving shoulder range of motion. The next question is, an OT is working with a 6-year-old child who occasionally drops their utensils when eating because of a slight decrease in hand range of motion grasp limitation. Which piece of equipment would the OT most likely recommend? So the correct answer is C, foam tubing around the utensils. So the foam tubing is a simple and cost-free solution that would increase the diameter of the utensils, making them easier to grasp for the child and reducing the likelihood of dropping them. So this approach is going to effectively address the minor grasp limitation without introducing unnecessary complexity of the task. The swivel utensils are not very beneficial for individuals with coordination rather than minor grasp limitation. Pediatric universal holders are usually designed for more severe grasp limitation, and weighted utensils are used for hand tremors or to enhance control, not to assist in grasp difficulties. The next question is, a 60-year-old auto mechanic with diabetes and hypertension the residual lower limb has been referred for OT for prosthetic training following an above-knee amputation. The first item the OT practitioner should address is inspection. So Skin inspection is the highest priority, particularly for an individual with diabetes and hypertension, because proper skin and regular inspections are going to prevent further breakdowns and infections, which are very important when managing the prosthesis. So nail trimming, this is less critical in this aspect because, therefore, let me say it again. Nail trimming, well, it's important. It is less critical than skin inspection in this context of the client. Retirement planning, it is not an immediate priority, and returning to work, this is going to be a long-term goal for the client. And the skin inspection, it has to come first. The next question is an OT. It's applying proprioceptive neuromuscular facilitation (PNF) techniques for weight shifting during an activity that requires an individual to use their right hand to remove groceries from a bag on the floor to the right. The most benefit would be gained from this activity by then placing the groceries in the upper cabinet to the left side. Actually, this is going to be the D1 pattern for the PNF. So the PNF techniques are usually focused on diagonal and rotational movement patterns. Reaching for the upper cabinet on the left side, it's going to involve more diagonal movements, which are going to enhance PNF benefits of wave shifting and trunk rotation. As I stated above, this is a D1 pattern. So if he's going to grab the bag from the right side, he's going to go ahead and put it in the upper cabinet in the left to complete the D1 pattern. Therefore, the other answers are not very suitable because placing items on the counter front or involves less challenging movement and does not incorporate the same diagonal patterns or rotational aspects. The next question is an individual diagnosed with chronic obstructive pulmonary disease is participating in pulmonary rehabilitation program. Which would the OT most likely recommend? The correct answer is A, perform pursued lip breathing when doing activities, because this is going to be an effective technique that helps control the breathing, reduce breathlessness, improve oxygenation during activities for individuals with COPD, which is a primary method used in pulmonary rehabilitation and, of course, to increase occupational performance. Answer B, long handle sponge. This will assist in further ADLs, but pursued breathing should be addressed first with the client. The hot showers, this can be worsening because the breathing issues can increase humidity and congestion. And avoid air conditioning rooms. Air conditioning can help keep the air cool and make it easier for the individual to breathe, so avoidance is unnecessary. The next question is an OT is fabricating a resting hand orthotic device for an individual with extremely fragile skin. Which areas will the OT have to inspect most carefully for signs of skin breakdown? The correct answer is the ulnar styloid, the distal head of the radius, the thumb, and the CMC joint. So these are areas that are very susceptible to pressure sores when using a resting hand orthosis because of their bony prominence and bony landmarks that are going to be easy to break down, particularly in individuals with fragile skin. So options A and B involve areas that are less prone to breakdowns in the context of using a resting hand splint. The next question is, which are the most appropriate intervention for the OT to plan in treating a person following a total knee replacement? So the correct answer is providing ADL training in the use of adaptive techniques for lower extremity dressing and transfers. After a total knee replacement, OT should primarily focus on helping the individuals regain independence in ADLs, including assisting in lower body dressing, transfers, and other activities of daily living. The goal is to ensure that the patients can function safely and effectively while they're recovering. Option A, using the upper extremity and strengthening of the upper extremity, it is important. This will be something that will be done later on because the main concern of total knee replacement is to improve mobility and independence with ADLs. The lower extremity range of motion can concentrate more on OTs can concentrate more on functional mobility and ADLs and the homemaking activities. These activities are essential, but they are not the primary focus immediately following the surgery. So the next question is, the administrator of a long-term care facility asked the OT who works there to help develop a job description so that they might hire a second OT. What would an OT job description most likely contain? The correct answer is letter D, job title, employer expectations, productivity expectations, and how the performance will be measured. Although the other options are also important aspects to include, it would be more suitable to highlight what the employer's expectations are, as well as to how the performance of the job seeker will measure, as this information will be clear and understandable of the position and help the future candidates be able to select the role. So the mutual goals of the relationship building, this is very important, but it is not typically included in the job description. Personal characteristics are very important. However, this is something that could also be addressed during a job interview. And a summary of the primary and secondary job functions, references, and physical exertion requirements can also be discussed during the interview. Thank you.